Hello all, again Ebola virus part 2. This is viral disease from clinical microbiology MB-CCTP9. In this, we'll study symptoms caused by Ebola viruses upon infection, various detection methods, that is laboratory diagnosis, as well as therapeutic agents and the prophylactic measure for EVD. As you know, this one is a deadly disease of humans, and your course of this disease is 14 to 21 days. Its incubation period is typically 8 to 10 days. That is upon entry of viruses in the body up to appearance of a clinical symptoms time required. That is incubation period. But it can vary between 2 and 21 days. Infection initially presents with sudden non-specific influenza-like symptoms, and patient usually develops symptoms abruptly in 3 phases. Here, there is a possibility of fever, chills, headache, then there is a myalgia, general malaise for few days. Pain in joints is also observed as a part of a symptom of Ebola. These symptoms are usually followed within the first week by progressive gastrointestinal symptoms. In that, there is anorexia, that is loss of appetite, nausea, abdominal discomfort followed by excessive watery diarrhea, vomiting, which may lead to severe fluid loss and intravascular volume depletion. During the second phase, the patient either recovers or deteriorates. That is, into the third stage it enters. The patient may develop neurological symptoms and collapse. There is multi-organ failure, as there is a acute kidney injury, as well as inflammation of pancreas, that is pancreatitis, acute adrenal failure, as well as involvement of liver is there, hepatic failure, because of which shock are common in advanced infections due to massive fluid loss as well as sepsis. Bleeding is one most important symptom in case of a Ebola disease. It is either in the form of a patchy. This patchy is nothing but a pinpoint round spots that appear on the skin as a result of a bleeding. One can say hemorrhage. This is present beneath the skin. With that, there is a discoloration of the skin. This is called as a ecchymosis. This one results from bleeding underneath the skin, also called as a bruising. You can see there is a oozing from venipuncture sites. That is, when there is administration of catheters beneath the skin in veins, at that time from that there is a oozing. Pregnancy-related hemorrhage is also common, as well as a mucosal hemorrhage. This was detected in 30 to 36 of cases in previous outbreaks. It was reported in only 18% of the recent outbreaks that stool contain blood. Major bleeding occurs late in the course of the disease in most cases, and death occur typically between from day 6 and 16 after the onset of symptoms. So this is list of common symptoms in case of a Ebola disease. Fever, as it is febrile illness, headache, as involvement of nervous system is there, fatigue, weakness, as involvement of a liver infection, as well as a gastrointestinal tract there, as well as a pancreas, nausea or vomiting, diarrhea, abdominal cramps, that is stomach pain, unexplained bleeding or a bruising, that is discoloration of a skin, muscle pain, and loss of appetite, that is anorexia. Some uncommon symptoms like chest pain, dyspnea, sore throat, prostration, as well as hiccups observed. So high-grade fever, that is more than 37.5 degrees Celsius, maculopapular rash, hepatomegaly, lymphoadenopathy, neurological signs such as mental confusion, coma, multi-organ failure. These are some uncommon symptoms. And this list of symptoms, they are according to Center for Disease Control and Prevention. Next part is laboratory diagnosis. Upon appearance of a symptom, the samples may be collected, but before that, symptoms also serve as a main tool for diagnosis of the disease. So physical examination of patients with suspected Ebola virus infection should be done with precautionary isolation procedures and personal protective equipment, that is PPE usage. It should include assessment of vital data as well as other possible findings such as a maculopapular rash, bleeding, hepatomegaly, lymphoadenopathy, and neurological signs. Means upon observation of all this, one can start laboratory diagnosis of the disease in the laboratory. Presence of a fever is also one important sign. Laboratory diagnosis of the virus can be achieved through assessing 2 points. Number one is host-specific immune responses to the virus, and second one is detection of viral particles or their components in blood after the onset of symptoms. So here, the viral particles can be detected by reverse transcription polymerase chain reaction, that is RT-PCR. This is in the blood after 3 to 10 days of symptoms. It may take months to be detected in other body fluids such as semen. If there is a negative result of this RT-PCR, the test should be repeated after 48 hours. This is to avoid early false negative results. During this period, testing for malaria is also routine for any suspected case. Now here you can see one table showing various laboratory methods, investigation methods in case of a laboratory diagnosis of Ebola. Some are Ebola specific tests, some are non-specific tests. So in the Ebola specific test, Ebola RT-PCR as well as ELISA are included. Ebola RT-PCR should be done for all suspected cases. And as you know, results appear from day 3 to day 6 to 17 of the symptoms, and repetition of it required if there is a negative result. That is, after 48 hours, one can repeat this test. While in case of a ELISA, it is highly specific test for Ebola. It is usually positive on day 3 to 6 of symptoms. Certain non-specific tests, that is complete blood cell count, can be carried out, as there is in the early stage thrombocytopenia as well as a marked lymphopenia. While in the late stage of the disease, there is a neutrophil leukocytosis. Other non-specific tests includes disseminated intravascular coagulation, that is DIC, which is again one important but non-specific test. Progressive decrease in platelet count is also one symptomatic type of a result of the laboratory diagnosis. Then bleeding, low hemoglobin can be checked. Bleeding profile is important. During severe infection and DIC, you can check this bleeding profile. There is a prolonged prothrombin time or activated partial thromboplastin time. That's why there is a late clotting of the blood, and so blood ooze out from the areas, sites where there is a administration of a catheters, needles in the veins. Here, arterial blood gases, that is ABG, these are also used for the detection and assessment of hypoperfusion and sepsis. So ABGS and various serum electrolytes, these are also checked in the laboratory diagnosis of a Ebola. Here there is, in case of a serum electrolytes, possibility of a hypokalemia. This is either due to vomiting and a diarrhea. Up to 50% cases, one can see such a type of a hypokalemia. And it is observed in fatal infection. Number of a liver function test also carried out. There is an increased alanine aminotransferase, transaminase, and aspartic acid transaminase, where AST rises more than ALT. There is slight increase in bilirubin as the increased level of hemoglobin is present in the patient's blood, free hemoglobin. And as you know, the metabolic end product of hemoglobin metabolism is bilirubin, level of which increases. Then there is an increased level of alkaline phosphatase as well as a glutamate transferases. So that one also checked Ebola laboratory diagnosis. Renal function test also carried out, as there is a acute kidney injury, possibility of an increased level of a serum creatinine or urea. This may be seen at the end of first week of infection. With that, some other tests also carried out to find out whether there is an involvement of a kidney or not, as hematuria, that is presence of a blood into the urine, as well as a presence of a protein in the urine, also checked. So in case of a severe disease, hematuria and proteinuria is also common. In the next part, after laboratory diagnosis, we'll see prevention and treatment of the disease. So all possible measures should be undertaken to reduce exposure to virus and prevent transmission in a healthcare setting And here this list of various means should be adopted. First one is a risk assessment of patient. With that, source control and personal protection measures play important role in the prevention of EVD. During patient's transportation, during handling sharps, that is needles, injections, etc., care must be taken. Precautions in the laboratory as well as dedicated patient's equipment like catheters as well as a blood stain cotton is required. Environment cleaning using appropriate disinfecting tools, then handling deceased patient's education as well as the education of visitors is also play important role in the prophylaxis or preventive measures for Ebola. There is lack of specific treatment for EVD, and that's why prevention is very important in the fight against Ebola. It is considered as a cornerstone in the fight against Ebola. Immediate isolation of suspected cases with prompt notification of health authorities is very important before proceeding any investigation to decrease transmission. Same is applicable for corona. That's why CDC developed one tool called as a Think Ebola to help healthcare workers to early diagnose and report suspected cases of Ebola. So according to guidelines by CDC, one can prevent transmission of the Ebola in society. At the moment, there is no approved vaccine or a drug available for Ebola. Whatever availability of a vaccine, it is based on experiments using volunteers, experimental animals. Treatment for Ebola as well as experimental vaccines for Ebola are under development, but they have not yet been fully tested for their safety or for their effectiveness. Current experimental approaches for treatment of post-exposure prophylaxis of Ebola virus disease are based on number one, antivirals. These are directly targeting the virus. Example is of small molecules which are inhibiting viral polymerases. Second one is phosphorothioate-oligonucleotides. These are used to block viral proteins production. Third one is single or multiple small interfering RNAs that silence viral genes. Next to which is compounds targeting host functions required for viral replication and spread. These are nothing but a multi-ion channel inhibitors and adrenoceptors antagonist as an inhibitor of a filovirus cell entry. Selective estrogen receptors modulators can be used to control late viral entry. Next category is of immune-modulating drugs. Aim of these immune-modulating drugs is to promote host defense and modulate the harmful host immune responses. Because compounds addressing coagulation factors, cytokines activity, multiple interferons, and anti-opioid peptides. With this, one can use plasma therapy also. By using single or multiple mono or polyclonal antibodies, one can neutralize viruses which are present in the body. So here, as there is no vaccine, passive immunization play important role in the treatment or in the preventive measure of the disease in case of a risk group patients. Finally, advanced life support is recognized as a key intervention to sustain and restore vital functions in infected patients. Some other precautionary measures include avoid any direct contact with the patients, as well as the dead bodies, the fluids, without using PPE. Maintain close monitoring of individuals who have been exposed to patients with Ebola virus to identify any symptom or sign as early as possible. Once the diagnosis of EBD is confirmed, should follow guidelines of CDC as well as World Health Organization while managing patients through isolation in special rooms, hand hygiene, standard contact and droplet precautions, and appropriate use of a PPE. Whatever vaccines developed against Ebola, they are not approved vaccine by FDA to prevent spread of Ebola. Experimental vaccines are available and have proved their success in protecting laboratory primates against lethal Ebola viruses. These include CAD3-ZEBOV, which is chimpanzee-adenovirus vector type 3 encoding for Ebola glycoprotein, first vaccine. This is most promising vaccine. Second one is a recombinant vesicular stomatitis vector encoding for Ebola glycoproteins. This is also called as a rVSV-ZEBOV vaccine. Third one is recombinant adenovirus type 5 vector encoding for Ebola Zaire and Sudan GP, a virus-like particle vaccine. And lastly, recombinant adenovirus alone. Multiple human trials have been initiated in many countries by using various types of vaccines. According to World Health Organization, in September 14, they informed that CAD3-ZEBOV and rVSV-ZEBOV are most advanced candidates to fight the West African outbreak of Ebola. Besides this, requirement is of a supportive care therapy. As there is no specific therapeutic agent are known to exist or treating or preventing Ebola virus infection, requirement is of such a type of a supportive care therapy. Treatment for EBD is primarily based on supportive care therapy, which includes balancing fluids and electrolytes to counter dehydration given by either oral or intravenous route. But there is a problem while administering that particular electrolyte by IV route as problem of hemorrhage. Administering anticoagulants early in infection to prevent or control disseminated intravascular coagulation, and administering procoagulants late in infection to control bleeding. So this is quite complicated type of a supportive therapy. Both types, anticoagulants as well as procoagulants, are administered depending upon type of infection, whether it is early or late. Maintaining oxygen status is also one part of a supportive therapy. Managing nausea, fever, and pain using paracetamol like medicines. Here, aspirin as well as ibuprofen, they are not used to decrease the risk of bleeding. Prescribing medications to treat secondary bacterial or fungal infections and minimizing invasive procedures is also part of this treatment. Treatment is instituted at an early stage, then there are chances of patient survival. Therapeutic agents under consideration for treatment or prevention of EBD include estrogen receptor drugs. These are normally used to treat infertility and breast cancer, but they are used here also. Clomiphene and toremifene is example of such estrogen receptor drugs. Next one is a favipiravir. This favipiravir has proved useful in mouse models. That is, use of it uh, in experimental animals. Nucleoside analog inhibitors of SAH, that is S-adenosylhomocysteine hydrolase, is also used in the treatment. With that, interferon beta, recombinant human interferon alpha 2, as well as a use of recombinant inhibitor of factor 7A, which is tissue factor, and activated proteins that is derived from horse or goat, which are immunoglobulins, can be used in the treatment. Human-derived convalescent immunoglobulin preparations, as well as recombinant human monoclonal antibodies against the GP, which is enveloped glycoprotein of Ebola virus, can be used in the treatment of this disease. DNA vaccines expressing either enveloped glycoproteins or nucleocapsid proteins, genes of Ebola virus, also tested. Patients mostly die from dehydration. As you know, there is a gastrointestinal disturbance, diarrhea. Chances of dehydration are always more. And also there is an electrolyte imbalance, which is either caused by diarrhea or by vomiting. Therefore, rehydration is very important therapy during the disease, which is either oral or intravenous. When it is oral, at that time, ORS, that is oral rehydration solution, it is provided. While in case of IV, as you know, intravenous fluids with daily electrolytes monitoring can prevent vascular collapse, and also it maintains electrolyte balance. So this is the chart showing type of a symptom and recommended therapy for that, as well as here second line drugs or which are not normally used in the treatment also shown. So when there is a febrile illness, paracetamol is provided. Here there is not recommended category to control fever is non-steroidal anti-inflammatory drug, as there is a chances of a bleeding and nephrotoxicity. This non-steroidal anti-inflammatory drug, that is NSAID, they are avoided. But if severity increases and if paracetamol unable to work at that time, this is also considered as a second line drug. In second part, that is if symptom is of a pain, uh, stomach pain, as well as there is a muscular pain, myalgia and headache, again paracetamol is recommended, and as a second line drug NSAIDs as well as opioids. This is mainly in severe case. Third symptom is of a vomiting. For control of it, metocloropramide, chloropromazine, ondansetron, these are recommended. Ondansetron, commonly used drug to prevent vomiting. As there is a diarrhea, loss of electrolytes and water, rehydration is prescribed. Zinc sulfate is also given with that. This is mostly in case of children. When symptom is of a heartburn, at that time, proton pump inhibitors like omeprazole, they are given. These are antacids. In case of a secondary infections, as there is a sepsis, requirement is of a broad spectrum antibiotics. So here third generation cephalosporins, they are given. When there are seizures, at that time, requirement is of a intravenous administration of a certain drugs. In that, if there is a problem in intravenous administration of a drugs, then intramuscular administration is preferred route. Or at the end, if no access for all this, then rectal administration of diazepam. Here, as a secondary line of treatment, phenobarbital is also used. If there is a persistence or repeated seizures, at that time with caution, this phenobarbital is given to the patient. The sedatives such as diazepam can be used in severe cases. In case of Ebola, as you know, there is an involvement of a nervous system. You can see some psychological symptoms also like anxiety, agitation, confusion, etc. So for this, as a supportive therapy, there is requirement of some psychic support, keep the patient in calm room, etc. So this is all about treatment part and supportive therapy for Ebola virus infection. So we can summarize this Ebola disease in this way. That is, the infection initially presents with sudden non-specific influenza-like symptoms, which is characterized by fever, fatigue, headache, joint or muscle pain, abdominal pain. But besides this, there is a abdominal discomfort, nausea, vomiting, diarrhea, and loss of appetite. That is general symptom of a gastrointestinal tract infection. And in the laboratory diagnosis, we can initially test for basic blood test, CBC, that is complete blood count, with a differential count, liver enzymes, that is for by conducting by performing liver function test, AGPT, AGOT, etc. Then test for presence of a bilirubin, creatinine, that is kidney function test. One can check blood urea nitrogen, that is BUN, as well as a pH. Confirmation of Ebola is by isolating the viruses and detecting its RNA and proteins. This can be done by using ELISA and RT-PCR. Detecting antibodies against the virus in a person's blood is also one method in the laboratory diagnosis of a EBD. Lastly, isolating viruses by tissue culture. So here this one require high containment laboratories, but this can be carried out. Detecting viral RNA polymerases by polymerase chain reaction, that is RT-PCR, and antigen detection by ELISA, that is enzyme-linked immunosorbent assay, is most specific test for confirmation purpose. One can check presence of various antibodies, IgM and IgG antibodies. These are mainly present during infection. Against this virus, they are highly specific, and so they are effective late in the disease in those who recover. Despite ongoing research in this field, none of antiviral agent or a vaccine for this Ebola virus currently approved by FDA for human use by the regulatory bodies. So this is all about Ebola. You can check for references given below. Thank you.